Why is bile duct cancer often diagnosed at late stage?
There are a number of reasons that patients are diagnosed at more advanced or later stages when it comes to cholangiocarcinoma. A lot of it is also centered around just difficulty in terms of understanding the tissue and the pathology diagnosis, as well as the clinical and medical workup that often happens when patients present with relatively vague symptoms. So, for instance, the biopsies that are obtained sometimes, depending on the location of the cholangiocarcinoma, are insufficient. So, for patients who have extrahepatic cholangiocarcinoma, they are often diagnosed via endoscopy, and those endoscopies involve brushings or cytology that sometimes don't really have enough tissue for the pathologist to have a definitive diagnosis. And even when you have an intrahepatic cholangiocarcinoma and you get a core needle biopsy, sometimes you get what we call necrotic or kind of dead tissue cells. And even when you have adequate tissue, there is not necessarily a gold standard test that they can do as pathologists that say, absolutely, this is cholangiocarcinoma, as opposed to an adenocarcinoma that has metastasized from another location. And so that complexity around really understanding tissue can be difficult, not to mention that when you see a mass in the liver, for instance, oftentimes the most common reason for having spread of cancer or cancer in the liver is from metastatic disease from other sites. And so patients undergo very large workups involving endoscopies, colonoscopies, PET imaging, which can delay the final diagnosis.